During a medical emergency, time becomes a most precious variable. And as the clock ticks, a speedy response and proper treatment are critical to saving lives, which is why high-quality trauma services are essential and can often mean the difference between life and death.
The golden hour has been defined by multiple trauma experts as that time frame from the time injury occurs until actual definitive treatment happens. That means arrival at an emergency department with the proper staff that can do surgical intervention if required. Trauma is basically a surgical disease, so the need for a rapid response, for staff availability, for the availability of your resources. Most hospitals really don't keep an operating room standing waiting for a patient to arrive. When you're at a trauma center, that's required. So you have a surgeon who sits here waiting for you to come through the doors 24/7, 365. And with that comes all of the technology and the staff that are specially trained to manage critical trauma patients.
Since 1988, the Northeast Pennsylvania Trauma Center at Community Medical Center has offered the more than 1.2 million people it serves dedicated staff, state-of-the-art technology, and a commitment to quality care. The NEPA's Trauma Center at CMC provides expert care in life-threatening situations while maintaining a 24-hour state of readiness each and every day of the year.
Our mission is to provide catastrophic health care to the citizens of Northeast Pennsylvania. No one expects to use trauma services, but in fact, catastrophic health care events can happen at any time to anyone. In fact, the #1 cause of death for Americans under the age of 44 is traumatic injury. Death by traumatic injury represents more days of lost life than cancer and cardiovascular disease combined. Statistics also show that if you're treated in an accredited trauma center, you have a 30% greater chance of survival.
This trauma team is comprised of experienced professionals, each representing a variety of medical specialties. By working together, they ensure a rapid response to the most urgent and critical health needs of its patients.
Community Medical Center has always enjoyed a rich tradition of dedicated staff that provide quality patient care for our community. With our trauma program, it is the culmination of the dedication and passion of the staff to provide this level of care for our community. It all begins when the trauma surgeon is notified that a patient is being transported to Community Medical Center. It is at this time that the team assembles. The team includes the emergency department physician, emergency room nurses, the operating room staff, staff from the intensive care unit, radiology and laboratory personnel, anesthesia, as well as the chaplain and the social services who are available for families.
Most members of the community don't realize the importance of a trauma center until they need it. Emergency departments serve a vital role in the community, managing patients who feel they need immediate care. When you go to a regular emergency department, you have an emergency department physician and trained staff who are there to take care of you. When you come to a trauma center, it is a serious dedication to that particular patient population. Everything stops when you hit the door as a trauma patient. So the CAT scan machine is waiting for you to identify your injuries. The surgeon greets you when you hit the door. The emergency department staff and all other ancillary departments, including other surgical specialties like neurosurgery and orthopedics, they wait to see what they need to do for you. So literally the institution will go on hold in order to minimize disability and prevent death.
Unless you have experienced a trauma, I don't believe that you can really understand the level of care that is provided here, as well as the technology that we bring to the community. And after we do have a trauma patient come here, families are so appreciative of the care that has been provided to their loved one.
About 10 years ago, my son, age 16 at the time, suffered a fall off a porch, landing on his chest. Took him to CMC Hospital where they discovered he had a ruptured spleen at that point in time. A blunt force trauma surgeon was able to quickly diagnose him, bring him to the OR, operate on him, and save his life.
The population is well over 1 million people who make use of this trauma center. It's care waiting for people, and it's essential if it's a matter of life and death. And that was something I learned in the course of my term on the board. And I thoroughly can testify that these are outstanding people who are dedicated to this community and to this institution. Everybody is there to make sure that this person's life is saved.
My son could not have received any better care if he was in the biggest city in the United States. I work for the Commonwealth of Pennsylvania as a public health nurse, and when you walk into a facility, you can tell quality care. You could recognize it in an instant. CMC has that. You can see it.
We have to maintain a state-of-the-art facility, which requires that we are constantly surveying and investing in state-of-the-art information technology as well as healthcare technologies. Ultimately, as we develop our electronic medical record at the medical center, we expect to bring to the care event a comprehensive medical record as well as the best of evidence-based medicine to support the care providers in our facility.
You get a different appreciation for life, so you work very, very hard to make sure the success of your patient is your success.
I think this job is the best in the world. I have a chance as a healthcare executive to ensure that patients in this region receive the best health care possible. The ability to expand our mission and deliver care to the citizens of Northeast Pennsylvania is what drives me.
Trauma changes lives in seconds. Our job is to ensure that minimal disability, if any, and death is prevented through rapid surgical intervention and top quality critical care.
In a life-threatening emergency, you need immediate access to expert care. Learn more about the Northeast Pennsylvania Trauma Center at CMC, when minutes matter. For more information or to donate, go to nepatrauma.org or call the number on your screen.